Welcome to Healthy Talk with BCH, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and today we're delving into a vital yet often misunderstood area of medicine, anesthesiology. Joining us today is Genev Calek, CRNA at Boone County Hospital. Genev, welcome to Healthy Talk.
Good morning.
Let's kick off by demystifying anesthesiology. Could you explain what it is and what led you to this specialty?
Anesthesia itself is just a state of loss of pain and awareness. Basically allows for the surgeon to operate with you not really having any idea of what's going on. What led me to this field is kind of a really random story. I've always worked in a field of taking care of people. I used to work in a laundry department in a nursing home as a young high school student, and I was taking clothes to a patient, and the family member saw me and thought, oh, what are you going to go to school for? What are your career goals? What do you want to do when you grow up, essentially? And I thought I'd be a dentist. I don't know, something like a good thing to do. And this person happened to be a CRNA, told me what it was, told me kind of what to expect with it as a career. Very brief interaction, and it's really what led me to completely change where my life went. So, yeah.
One conversation with one person can totally change your life.
Yeah, absolutely.
So what are some common misconceptions about anesthesiology and the work you do?
It's definitely more than just putting people to sleep. We have different areas that we assist in, especially in this hospital. We assist with OB, we place labor epidurals for pain management and labor and delivery. Sometimes we are called for sedation, whether it's assisting in the ER or maybe assisting on our surgical floor in a patient who is in a critical state, whether they're going to be transferred or they just need another set of hands. Anesthesia itself really can be even more than just that. Larger facilities, they can do cardiothoracic anesthesia, they can specialize in critical care anesthesia, they can specialize in neurosurgical anesthesia. Another subset is chronic pain management, which we also provide as CRNAs. That's those who have additional training can follow up with patients for that.
Obviously, it's a very specialized field. What did your schooling look like?
My schooling was a nursing route versus an anesthesiologist who goes a physician route. For me personally, I went to school to be a nurse. I had to also obtain a bachelor's degree in nursing. Then I had to work in an intensive care setting. The minimum for most requirements for programs is at least a year. I worked almost 4 years in an ICU before I went back to school. For that, I obtained a master's degree, so I have a master's degree in nursing. Programs currently offer a DNP or a doctorate of nursing practice to practice as a nurse anesthetist. And then following that, I had to pass a national certifying exam to be able to practice in the state. Physicians, they go to medical school for 4 years and then follow up with a 4-year residency before being board certified after that.
Gotcha. How do you stay up to date with new technologies and methods in the field of anesthesiology?
The American Association of Nurse Anesthesiology offers a lot with continuing education. There's a journal that is published. The American Society of Anesthesiologists also has a journal that is published as well with up-to-date research, changes in practice. There are also lots of different conferences that we can follow up with. There's also the Anesthesia Patient Safety Foundation. They also have a newsletter that they put out, so that way you can improve patient care and maybe better practices to prevent harm to patients. Also, podcasts.
We like podcasts. So can you walk us through a typical day for you? How do you prepare a patient for surgery? What's your schedule look like?
Well, really, it's more than just the day of. This might even start in the weeks prior to, for certain patients. During the pre-op visit, it's very important to visit with the patient, assess their needs, and evaluate them, maybe develop a plan on what their expectations are and how we want to work together to take care of them for the day. Also need to obtain their medical and surgical history or any personal or family problems with anesthesia. We might have to review medical records for patients who are at higher risk, or at least review medications with our pre-op staff, patients might have to change what they're taking leading up to surgery for whether it's reactions to anesthesia or to prevent issues with the surgery itself, such as bleeding. The day before, we review the patient's charts to have an idea how you might want to best take care of the patients before they come in. The day of, we come in, we have our operating rooms we need to go in to make sure we have the supplies we need for the day. There's an anesthesia machine that we need to check out, make sure everything is functioning appropriately, and then go visit with our patients, see what their needs are, and then once you're done assessing the patient, get your drugs and your plan in order for that particular person.
Can you talk about the different kinds of anesthesia that there are?
There's basically 4 main types. One is local anesthesia, where a small area is numbed. Another type is monitored anesthesia care. That's sedation. The patient's essentially sleeping, breathing on their own. Another type is regional anesthesia. That can be spinals for maybe a C-section or orthopedic surgeries, epidurals for labor and delivery, or peripheral nerve blocks where you essentially numb a set of nerves, so part of the body is numb for surgery. Or general anesthesia, which most people think is the going under, you're fully asleep on a ventilator while you sleep for surgery.
What are some risks with anesthesia?
Well, most people don't have serious problems undergoing anesthesia. One thing you worry about is maybe a reaction to a medication. It's very important for us to obtain a family history of issues with anesthesia. There can be family trends of life-threatening reactions to anesthesia. Certain medical personal history might also put you at risk for a reaction under anesthesia. Even having allergies, we might have to treat you with different medications just to prevent that risk. But one thing people seem to always be worried about is awareness under anesthesia. When you talk about different types of anesthesia, the monitored anesthesia or the sedation, you might remember bits and pieces, and that's okay. Our goal is just to make you comfortable and not feel it for those procedures. But under general anesthesia, the risk of awareness is really rare. I looked up stats. It's 1 or 2 per 1,000. And certain surgeries are more likely for that to happen, and especially emergencies, trauma, cardiothoracic surgery.
You probably deal with some patient anxiety as well. What are some ways that you calm people down or reassure them?
Finding out what is it they're exactly worried about. Identify what they feel as the anxiety. Then you can help educate them on what you're doing, what you're here for, and kind of explain, well, you are having general anesthesia. You shouldn't have awareness. We actually have monitoring that we use to help understand how deep they are under anesthesia, and a lot just with education.
Sure. I would assume that post-operative care is also a part of your role. What do you do to approach pain management with post-op?
Post-op planning always starts pre-op. When you assess your patient, you can maybe identify what allergies they might have, or if a patient's had surgery before, they might say, yes, this always works for me. This might not work at all for me. Kind of just listen to your patient to help with that. Also depends on the type of surgery. If they're having a surgery on an extremity, we might be able to do a nerve block to help with pain relief post-operatively.
So has the opioid crisis changed your practice?
Well, there's definitely been some different protocols and research out there to kind of identify maybe a different way of giving anesthesia. There are protocols out there for opioid-free anesthesia. It's different drugs that affect pathways to reduce pain without necessarily having to use narcotics. And there's another protocol at ERAS. It's an enhanced recovery after surgery. And anesthesia plays a part in that too, because it's got multiple approaches to help with pain management and how to facilitate recovery after surgery.
How do you navigate the ethical considerations involving administering anesthesia, especially in complex or high-risk cases?
For patients, especially who have complex medical history or high-risk cases, we really need to identify what they might need post-operatively. Will they need an ICU afterwards? What sort of care might they need? The quick availability of maybe other specialists such as cardiology or pulmonary care afterwards. So we just really need to focus on the patient, their history, maybe decide who should stay here and maybe who might need to be transferred out.
How is your surgical team? How do you navigate working with other people in the surgery room?
Well, it's definitely a team approach. We cannot work without each other. No one is going to let the surgeon operate without anesthesia.
Right.
And there's no need for anesthesia if you don't have a surgeon to operate likewise. But it's a very much a team approach. The nurses play a lot in the pre-op evaluation, phone calls, admitting, discharging, discharge instructions for the patients. And we have surgical technologists as well who are very much the extra hands for the surgeons intraoperatively.
What are some of the most exciting innovations in the field of anesthesiology that you've seen in recent years?
Well, like with all research, new drugs for lots of different things are always being created.
Okay.
And it's kind of fun to see even something as simple as reversal drugs, how people can maybe recover so much quicker afterwards. Or shorter acting medications patients may receive. If they're having a short procedure, they don't need to forget the entire morning. Some of these newer medications are really quick on, quick off, and people can kind of carry about their day.
How do you see the role of AI and technology evolving in your field?
With AI, there's definitely been some research out there to kind of figure the algorithm on controlling the delivery of anesthesia, or how you would monitor to maintain a certain depth of anesthesia, or maybe even predicting patient reactions to anesthesia. I mean, technology has changed a lot in my career. I used to start with paper charting and writing everything down, and now we have electronic medical records, and even other facilities, you don't write anything at all. Everything just goes straight from the machine, straight to the computer.
That's nice.
And records it all for you.
So you said your career kind of started off because one person said something to you. So do you have any advice for others who are interested in the field of anesthesiology?
Well, if you have a passion for caring for people, it's a great field to be in. If you're not really sure what anesthesia is or what exactly we do, finding somebody to job shadow, kind of come with us for the day and kind of see what we do.
You do.
Yeah.
And last but not least, where do you see the field heading in the next decade?
I think there's going to be newer advances on medications and maybe even different anesthetic gases that we use. That's one of those things that's been around for a while, what we use currently. I'd be excited to see if there's something else that they might create that's even quicker on, quicker off kind of medication, helping patients recover even better following anesthesia.
Thank you so much for sharing your insights and experiences with us today. I've learned a lot. Because like you said, you kind of think anesthesiology, you just think.
You're just sleeping. Yeah.
There's so much more. So thank you so much.
Absolutely. Thank you.
Well, that's all for today's episode of Healthy Talk. If you ever have any questions or want to learn more, visit our website, www.boonehospital.com, or follow us on social media. And of course, be sure to subscribe and stay tuned for more episodes. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.